Hey guys, this is Caesar with Nursing School Made Easy, and today's topic, today's lecture is going to be focused on hemorrhage. So let's get right to it. Let's focus on the causes. Number one, trauma. So this would be, for example, anything like a stab wound, gunshot wound. That would be a trauma that may cause severe hemorrhage. Number two, surgery complications. Number three, something like a bleeding ulcer. Four, maybe an aortic aneurysm that ruptures. Now, you could technically put these into trauma also, because that would be trauma to your tissues, to your organs. Okay? Now, what would be some clinical manifestations? What would your patient show? Again, as always, for your NCLEX, make sure you understand your clinical manifestations. Number one, tachycardia. Do you know why? Well, maybe there's some folks out there that don't know why yet, so let's take a step back. Now remember, you're bleeding out. Okay, hemorrhaging. You have blood loss. Well, your heart still has to try and pump blood to the rest of your body, to your brain, to your lungs, to your kidneys, to your heart. But you're losing blood, so the only way to maintain the same amount of blood everywhere is for your heart to beat faster. So if your heart begins beating faster, you have increased heart rate or tachycardia. That's what that means. Just really fast heart rate. Okay. Two, postural hypotension. Again, you're losing a lot of blood. You don't have that blood pressure the way it should be. Because again, you're bleeding out. So if you're changing positions quickly, turning your face fast, turning your head fast, going from sitting to standing or laying to sitting position, your body cannot compensate. It cannot do what it did because, again, you're losing blood. So you will have postural hypotension. So you, again, want to make sure you tell these patients to move slowly. Last thing you want is for them to try and get up. They pass out, they fall on the floor, hit their head, and now they have some type of head trauma. So again, these patients, you want to tell them to move slowly. Number three, we talked about this with tachycardia, but you'll have decreased cardiac output. Again, decreased cardiac output because you have less blood in your body. Your heart is beating faster in order to meet the demand, but because it's filling faster and because you're losing blood, you're not pushing the same amount of blood out. In fact, you're pushing less blood out. So again, you would have decreased cardiac output. Four, thready pulse. Thready weak pulse. Again, this has to do to the blood loss. Five. Jumping ahead of myself here. Now, as you begin to lose more and more blood, what the brain is going to do is it's going to make sure it brings blood from areas that it doesn't really need to areas that it does need. For example, your heart, your brain, your kidneys, your lungs. These are areas that need blood constantly. Your brain needs blood always. So does your heart. So areas, for example, like your skin, that do not need blood or that can go without blood for longer periods of time, well, blood isn't going to be delivered to that area. In fact, it's going to be taken away from that area. So for that reason, you will have pallor. You will have cold and clammy skin. Again, your own brain is telling your body, nope, 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 nope. We're taking the blood away from that area and we're going to focus it on the important stuff, again, on your heart, on your kidneys, on your brain. Now, if this is not corrected, if the blood volume is not returned, patient will undergo shock. Other clinical manifestations, maybe something like pain, especially, for example, if there was some type of rupture, if there was some type of trauma, maybe a bleeding ulcer, you will have pain. If you're bleeding on the inside, that blood is pulling somewhere. If it's pulling, if there's a swelling, well, that swelling is going to cause some pressure, and that pressure will cause pain. So again, pay close attention to your patient. Listen to your patient. If they're telling you they're having some pain, find out why. 9. Decreased hemoglobin, decreased hematocrit. Now, please understand that if the patient is bleeding out right now, and if I were to draw their blood right now, their hemoglobin, their hematocrit is going to be normal. Hemoglobin and hematocrit will not be, or they will not show large differences until about 36 to 48 hours after. So again, do not rely on just your lab work, because your lab work will most likely be normal. Again, results really won't be that accurate until about 36 to 48 hours after the incident. So do not rely on your lab work. I've had a lot of patients that have had some type of hip fracture and they had surgery. Blood was drawn and it was normal, and then a day or two later you see that the hemoglobin is 7.8, and then you have to give blood. So again, do not trust your hemoglobin and hematocrit blood levels as 100% accurate, because they're not. Again, you won't see the results until about 36 to 48 hours after. They will not be accurate, okay? Now again, interventions. What would you do for your patient? As always, and like I mentioned in other lectures before, make sure you know your clinical manifestations and your interventions for your NCLEX exam. Number 1, for interventions, going to replace the blood volume. This will be determined by the physician, of course, but most likely you will give something like LR, lactated ringers. 2, you're going to stop the bleeding or report the bleeding. If it's internal, you may not be able to stop it. You might have to inform the physician right away. You may have to give something, for example, like a blood transfusion of packed red blood cells. The other thing that you may also have to do, once you've given the packed red blood cells, later on you may have to give some type of supplemental iron, whether it's IV or PO.